can you just snap out of depression? Is it possible to deal with crippling anxiety by just smiling and chilling? And if you don't have any disorder or any illness, if you're not suicidal, for example, or if you don't have a phobia, but you're still struggling, maybe not doing very well with relationships, or you're not eating well, or not sleeping well, do you then need professional help, especially when it comes to mental health? To answer this and every basic mental health question, let's talk to Varkha Chulani. She's a clinical psychologist, a psychotherapist, and an enablement expert. And I'm going to ask her at some point what all of this means.
Sure.
And thank you so much, Varkha, for joining us here.
Pleasure. Thank you so much for having me on your portal. It'll be a pleasure.
Thank you. My very first question to you is, how does someone really know that they need professional help to deal with their mental health?
So what we want to look at is that, is there a significant period of time where a person is unfortunately dysfunctional? That means is not able to do the simple day-to-day things of life, like get himself or herself out of bed, be hygienic, do what is expected of him or her. So say for a school student to go to school, for people like us to come to work, for interpersonal relations to be able to find ourselves not getting into unnecessary interpersonal altercations all the time. So we look very closely if there is a significant period of time that a person has unfortunately not been able to lead a relatively healthy, and I would may add, a happy life. So I think it's very important to keep time as one facet. Of course, it's not the only facet, but many a time the saying, time heals, is a very important consideration which we sometimes do not really take into cognizance. In fact, in medical science, it says sometimes just stand there, do nothing. Because many times what we go through are just regular periods of emotional expression, emotional experiences. And then the minute it goes on for even a couple of days, we just get so wired up and so wild up that we want to actually run and seek help. Uh, the human body is capable of healing, and I don't think we are paying too much attention to that. We are actually short circuiting all the healthy emotions like sadness, disappointment, irritation, annoyance, regret, some amount of maybe healthy jealousy, as I call it. Okay. And we just don't want to experience anything negative, so to speak. So when you are so afraid of just experiencing human emotions which are facilitative, and there is a semblance or a sign of anything which is slightly not in the positive realm, you and me jump and start wanting to seek professional help, which I think is extremely unfortunate. And then to add to that, many professionals do not actually tell the person, hey, you know what? You're grieving. Say today, with this 1.5 years of COVID, there have been loss, there has been illness, there have been all kinds of disruption. And I think it's very important to allow a person his humanness, his ability to go through a regulatory process of loss, grief, bereavement, distress, dissatisfaction, the kind of concern about, say, losing jobs, not having enough money, etc.
Yes.
Now, that honestly doesn't call for therapy at all. And
Okay.
that is not mental distress. Okay, that is a regular part of emotional experience, which is the distinguishing feature of us being human, right? Why are we trying to be superhuman, or why are we allowing ourselves to turn into robots or into objects, into inanimate things which don't feel, which don't experience, which don't emote? So I think we're scared of emotionality, and everything that is emotional is literally being put under the scanner and magnified, which is unfortunately unnecessary.
Okay, this is interesting. You know, I'll ask you the same question in a slightly different way, because I want to make sure everyone gets it and I get it as well. So, do people who are not struggling with a disorder and who are not, quote unquote, mentally ill, but are generally struggling,
Yeah,
you did say that, okay, this is a spectrum of normal human emotion, and you
correct.
don't have to seek to pathologize or make a big thing of what is actually general human emotion and day to
Correct.
day struggles.
Yes.
Someone gave me this analogy, and they
Yeah.
said, you go to a doctor when you're sick or ill,
Not
you want to
always.
get cured of a disease, and then you go to a gym to
Hmm.
when you're healthy already, but you want to get healthier or fitter.
Hmm.
So my question is, for mental health, is there such a situation where, quote unquote normal person can go to a mental health expert to get fitter and healthier? Does
That's
that work?
exactly
That kind
why.
of analogy work?
Of course, that's exactly why I call myself also an enablement expert. I enable people to do better in life. I do not label, I do not categorize, I do not believe that they have a disorder. But how many people are actually able to make that distinction, even professionals? That today, you're absolutely right. That when I go to the gym, it's not necessary that I'm obese. I'm going to get fitter. When they come to people like us who are qualified therapists, we are hoping that one, we use our ethics, our discretionary power to distinguish and not unfortunately label this as something, and then facilitate them to get to the life that they want. But then that is not considered a mental illness. In fact, that's called self actualization. That today Maslow, the great psychologist, said that after you've gone through a certain steps of physical comfort, safety and security needs, you come to a process of self actualization. But I'll be very candid here, Venkatesh, in a country which cannot afford physical health, very few of us would, unless we are the privileged few, like maybe you and I, okay, would really have the bandwidth to actualize. So, of course, if today there is someone who comes to me with no disorder, and there are many like that actually, who do not necessarily have a clinical diagnosis, but yet want a perspective, want to jump over the little bit of hurdles or obstacles that life gives them, and I enable them to do that.
Got it. Got it. That makes a lot of sense. Okay, so I'm going to ask you some more questions about mental health, help, and mental illness, and there's a lot of confusing terminology out there in the field. So maybe
There's
we
a
can
lot of
start with
jargon.
explaining.
There's
Yeah, maybe I
jargon.
can start with just asking you the three different hats you hold: clinical psychologist, psychotherapist, enablement expert. What do these three terms mean?
So, a clinical psychologist is basically a kind of training which is imparted to us during our master's degree, because there are various fields. There's social, there's industrial, there's educational, there's clinical. Okay. When I qualified with my master's, my training was in a hospital setting with patients. That means with real people with emotional abnormal disorders. So they could be actually diagnosed, called schizophrenic, called paranoid schizophrenics, called delusional disordered people, called actually clinically depressed, generalized anxiety. So there were actual criteria that were met in the DSM. At that time when I was studying, it was, I think, DSM-3. Now it's DSM-5R that is revised. Okay, so there are protocols that a patient, a client has to meet to be labeled in a clinically disordered way. And that's the training of a clinical psychologist, to be able to understand, to be able to evaluate, to be able to correctly diagnose on the basis of scientific study, which is psychometric evaluations, and then seeing if they meet all the criteria as expressed in the Diagnostic and Statistical Manual for Psychiatric Illnesses. So my training was in a clinical setting in a hospital for
Got
two
it.
years. Okay. Then post that, I decided that there are 330 schools of psychotherapy, and I had the privilege of meeting my professor who came for a guest lecture to the University of Bombay, where I was doing my master's, and he did a 2-day workshop in rational emotive behavior therapy. It aligned very well with the way I think, how I am in my personality. I'm quite radical in the way I think, and the basis of that system of therapy is that all emotional disturbance is due to flawed, faulty ideologies or systems of beliefs. And when I heard him for those 2 days, I decided to follow up. It's been more than 25 years that I have studied only this one system. And that allowed me to become a psychotherapist. So, most people do psychotherapeutic training post their masters, and that is a prerequisite. because the belief of a good therapist is he must or she must know his or her psychology, physiology of the brain well enough to be able to then start going into training for therapy. So I did my professional training in rational emotive behavior therapy. I'm an associate fellow and supervisor of the Albert Ellis Institute. Dr. Albert Ellis was the grandfather of cognitive behavior therapy, and he brought to the fore rational emotive behavior therapy. So Freud brought psychoanalysis. He brought rational emotive behavior therapy. I had the privilege of studying under him. In fact, he's given me a forward to my book, For the Thinking Woman, and he's no more now. So that was my psychotherapeutic, kind of training. Well, then, as you said, as I started my work, I realized that everybody does not need therapy per se. Okay, and all they need is sometimes a perspective, and sometimes just a little bit of push or a nudge in the right direction. And that's when I started to kind of equip my knowledge, self knowledge. This is, I haven't had any training, professional training to enable people, but I did a wide array of reading of biographies of successful people, etc., and decided that I will not label, I will not judge, I will try and see if we can just push them into the direction which they're going. And that's how I came up with the term enablement expert. So I'm a clinical psychologist, I'm qualified to diagnose. I'm a qualified psychotherapist. I know my therapy, I know what I do, and also I know that everybody doesn't fit into certain checklists or boxes, and all they need is a kind of a, enabler to push them into some kind of direction when they're lost, or sometimes when they have a little bit of hurdles and they kind of feel like giving up.
Got it. Okay, so your your explanation of the three hats that you hold and juggle gives rise to a very natural question, which is, you said you were qualified to diagnose. I mean, and again, from a person who is coming into this completely cold, there is a lot of misconception around seeking help for mental illness, and a lot of people I speak to, generally in conversation say, what, I don't think I can handle medicines. I don't want to take medicines. So, I mean, I want to ask you this very basic question, which is, what is the difference between mental health help? I'm not using any jargon, obviously. Mental health help, which requires medication and which doesn't require medication. How would you explain that to anyone?
So there's a distinctive difference, first of all, in the background and in the training that a psychiatrist would receive, and what a person like me, say, for example, in a master's degree would receive. We are not trained doctors. A psychiatrist, by definition, has to have done his or her MBBS as a prerequisite and then gone into either Diploma of Psychiatric Medicine, that is DPM, or an MD in psychiatry. The basic difference is that in psychiatric training, the entire module is based on the dysfunctionality of the brain. That means the chemicals which are released by the brain are either in too much quantity or in too little quantity. So, the chemical imbalance per se is the reason for the person's psychological distress, right? So the entire model of treatment is medical. It's a medical model of treatment. Sometimes it goes into even electroconvulsive therapy, which is shocks in simple language. And more often than not, it just restricts itself to certain kind of, SSRIs, all kinds of reuptake inhibitors, all kinds of antipsychotic medication, antidepressants, anti-anxieties, etc. Because the belief of the psychiatrist who is understanding clinically his patient is that this person has a chemical imbalance. But let me be very
Yes.
honest. I think in a country like ours, and I'll only speak for us because I've done most of my work here, is we have something I feel which is an error of omission. Uh, Psychiatrists do not ask enough questions as to what are the other possibilities that may be causing this kind of dysfunction, a chemical dysfunction. Has there been brain injury? Has there been any other medical use of any other drugs, in terms of sometimes we have age related diseases like dementia, etc., where medication is provided, and then as a side effect of that medication, you have a person going into a depression. uh,
Yes.
I've had young girls and boys at 22, 23 who use medication to clear up their acne. Now that leads to suicidal ideation as well, right? So we are not, according to me, doing enough to check and rule out variables. As a woman, my hormones play a significant part. I may be having something called what regular people call PMS, that is premenstrual dysphoric, no, sorry, premenstrual syndrome. But there is something called PMDD, premenstrual dysphoric disorder. Now, that is because of the change of the hormones in my body just before my period. Now, if I get agitated and I go to a psychiatrist and he's not going to ask me these questions, he may diagnose me as bipolar and having mood swings, for example, when
Yes,
actually
yes.
it's a hormonal condition. So I don't think as a country we do holistic assessments. When we go to a psychiatrist, we only jump to conclusion that it's all in the head. We do not rule out physiology. We do not rule out hormonal imbalance. We do not rule out any use of other drugs. Today, with weed becoming such a common phenomenon, with all kinds of substance use becoming such a
Yes.
common phenomenon, they also affect our mood. Now, I need to have the patience, the time, and of course, the understanding how those affect our emotional condition and ask the proper question, and maybe last come to a psychiatric diagnosis of some sort, which I don't think we do. But I'll put that aside. Now come to a
Yes.
difference between a clinical psychologist. So we diagnose on the basis of the parameters that are listed in the DSM. But not only that, we have to also be trained to understand that is this a chemical imbalance or is this attitudinal? And that's where my therapy training comes in. Because I'm a qualified therapist, I'm able to maybe in a session or two understand that, what, this is going to require more than just me to help the person, because there are actual conditions, either physiological. So then I refer to an endocrinologist, or I often, check physiology like vitamin levels, other aspects which will play a part in the mood condition that the person has come to me with, or I work in tandem with a psychiatrist so that we both work parallelly, where he or she gets medical support because there are some conditions in this person, and over and above that there are attitudinal, what would I say, unfortunate belief systems which are also compounding the problem. So
Okay.
a good therapist is able to make a distinction quickly enough, refer if referrals are needed, and be able to make a discerning distinction between chemical imbalance and attitudinal. So in psychiatric practice, it's a medical model. In psychotherapeutic practice, like mine, I don't speak for the other therapies. It's an educational model. We reconstruct.
All right.
Psychotherapy is nothing but a reconstruction of attitudes.
Oh, that's very very clarifying. I'm going to actually just to take this a little further. I'm going to make some assumptions, and I'll ask you to kind of clear them for me.
Sure.
And I also want to talk about how there are different types of therapy. But
Yeah.
first, the assumptions, which is somewhere I read that the word counseling also gets tossed around a lot, and so somewhere I read that counseling is about giving advice, but therapy is about listening. Is that necessarily true? Would you distinguish between these two, or are they the same thing?
So, counseling and therapy is nothing but synonyms for each other. But I have a caveat here: there are self style counselors. And honestly, therapy is never about giving advice, and neither should counseling be so. Therapy is understanding a faulty philosophy of living and having the ability as a therapist, one, to identify it, and two, to have the methodologies and the tools to help the person correct it. So we never give advice. We are, in a way, like Socrates. We use dialogue to be able to help the person break his or her own beliefs, because we know that the cause of emotional distress, if it's not chemical, is attitudinal, and it is the skill of a therapist to be able to, one, so diagnose. So Dr. Albert Ellis used to say it very well. He said, as I listen, I'm treating, because as I'm listening, my diagnosis is being formed about what are the faulty philosophies this person is unfortunately subscribing to, and therefore making himself or herself unfortunately miserable. So, so listening is very important because that gives me a revelation of what the person unfortunately believes in. But that doesn't stop there. So I am not an agony aunt where somebody can lean on my shoulder and cry. I am not that. I am a leader. I That's why rational emotive behavior therapy is known as tough minded therapy for tender minded people. It is tough. It teaches you that life is not a bed of roses. It reconstructs your entire worldview. It dispels myths that life should be fair, that the world owes you a living. It actually empowers you to tough mindedness. So one of the my by whatever words is developing emotional muscle. It's like going to the gym. I lift weights, I become physically stronger. By using my system of therapy, we believe that we could help people become emotionally more robust and have the emotional stamina to cope with the challenges that life is always going to throw. It's not that problems end in life, they just change.
Right. I mean, that makes sense. Okay, I'll toss another assumption out there,
Sure.
or something that I've read, which is that the term wellness and mental wellness and coaching also gets tossed around a lot. And somewhere I read that coaching is a how what was the quote? Therapy is a path to tears, and coaching is a path to laughter. Um,
First time
uh,
I'm hearing this. Really?
No, it's just that that's the problem with these quotes. They tend to be catchy, but sometimes
Yeah.
they obfuscate a lot, and they don't really. It's not about telling the truth necessarily.
So
So I
can I
mean,
be
anyway,
honest?
pardon?
So can I be honest that
Yes, of course.
I've been completely anti-coaching because everybody seems to be someone who wants to coach, whether it's a life coach or it's a work coach or whatever. But at the end of the day, fundamentally, I feel that because coaches often, if you see all people who've gone to coaching, and I know I'm being very radical here, are people who haven't actually been able to solve some of their own challenges of life. One, okay. Uh, it's not as simple as replacing reading a book and being able to kind of teach. These are motivational ways that people look at documents and be able to go and give lectures, etc. But the basic thing that one person needs to ask is that which habit have you been able to alter because of your coaching? And I've found, even in my own life, the biggest problem in human beings is the lack of consistency. So we'll start something, and then after 5 weeks or 5 months, we will give it up. And that is where good diagnosis of belief systems, what is the basic outlook, the philosophy that this person suffers from, which doesn't allow him to lead a consistent and a persistent life. So coaches, unfortunately, they may do some good work, I'm not saying no, but they are not able to maybe lead to sustained behavioral change, which for me, and Ellis again said that beautifully, life is not about feeling better. I can come talk to you, Venkatesh, and feel very nice. Life is about getting better. And how do we see that? We actually see it in behavioral changes, where for me, measure of actual doing, action, is a reflection that my therapy is working.
Okay, yeah. Uh, for me, I mean, again, the other problem, of course, is when I use a term in a certain way, or when a person uses a term in a certain way, they may not mean it in exactly the sense that somebody else uses it.
Yeah.
And I guess that's probably why there's a lot of this confusion that kind of happens. Okay, for a person who's seeking therapy, there seem to be a variety of options out there. It's kind of puzzling. Some focus on just speaking, and some focus on real behavioral changes, and I don't know what the spectrum really is like. So what would you say to a person who doesn't know anything at all but is seeking therapy? What kind of therapies are there?
There are 330 schools, right from Freud's psychoanalysis to Ellis's rational emotive behavior therapy to Beck's cognitive behavior therapy to Gestalt and all kinds. I have only specialized in one. What I would say is therapy has to fit also the person. As I said, my therapy is tough, very tough. It's actually asking people to take accountability and responsibility for making the life that they want. Not everyone is aligned to this kind of style because, well, it's telling you to grow up and take, uh, you know, take the responsibility of life. Now, psychoanalysis, for example, is always going back to your childhood and allowing you to wallow in what your parents did or did not do, and all the traumas that you unfortunately may have suffered, which you may have. Okay. But we are very clear that we are not archaeologists. We don't dig up the past. We are psychologists. We teach you, yes, your past may have had some influence on your future. But what is it that you need to break today so that your past may have some influence on your present. But what do you
Mhm.
need to do today to break those experiences into more sensible, realistic evaluations so that your future is a much healthier, happier one? So I would just say that anyone seeking out a therapist, first please ask for the qualification of a therapist. What is his or her school of training? What his has she or he been trained in for a long enough period of time? Where has she trained? Has there been supervisory training? Is she qualified to do the therapy that she or he does? So these are extremely important questions to ask. Don't ever feel shy of asking your therapist his or her credentials. It's very important. And
No,
if they just and if they've just done like one or 2 years either coaching or counseling courses, please do not go to them. Second is that you have to. So many people ask me, how many sessions will I need? I said, I'm not going to decide that. You're going to decide that. Come, let's have one session. Let's see if you and I get along. Because I think one of the aspects or a myth that surrounds most of us as helpers is as if, we don't have our own biases. We don't have our own prejudices. That we will not like or dislike certain people. Of course we do. So we also have to get along. There has to be a collaboration between me and my client, that he or she trusts me. I also like him, because if I'm not going to like the vibe or the kind of non the body language or the kind of attitude that he or she comes with, I'm not going to be able to do an honestly good job with that person. So I think it's very important to see that you and your therapist are able to match in what is the kind of therapy the person is going to do with you. You have to be
Mhm.
able to be very comfortable in that. And two, you have to have an element of trust and a belief that this person is, one, able, so he or she is able with his or her work, and two, means well for my well-being. That it is, her job seems to be that she's really interested in me and is not only interested in herself and in getting more patients. So there has to be a dynamic between both. And I remember when I give my other interviews, when I say that the therapist has also to be comfortable with the client. I think eyebrows get raised. We are at the end of the day as human as anyone, right?
Yes.
So we've been always told, in my training I've always been told that, say for example, if I'm anti-abortion and someone comes to me having had an abortion, my biases and prejudices will kick in. So I better not treat or help this person and refer, because I will not be able to do objective good work, because my own outlook towards whether we should abort or not will interfere in my ability to be able to help this person. So we have to be very true to ourselves as well.
Yes, Varkha, but there is an offshoot of that question. One might be looking for therapy and then might find that there is a therapist they've been referred to who's specialized in, you mentioned Gestalt, or you mentioned psychoanalysis or psychodynamic psychotherapy.
Yeah,
uh, they don't know what all of that means. So, are
correct.
you then saying that it makes sense to arrange a meeting with a psychotherapist or any psychotherapist and
Yeah,
then ask that psychotherapist what kind of therapy they should be doing?
yeah.
Is
Or
that what you say?
refer
Because
on them.
it's almost as if we need an interlocutor even before therapy. Someone who's going to look at you, ask you certain questions, and then say, "Oh, it's like the sorting hat in the Harry Potter stories.
Yeah,
You go here to this
yeah.
therapist, you go to that kind of therapist. That kind of service is not available. So, what
No,
does a
so what
person do?"
I think, research the person you're going to see. Get to know at least some basics of what he or she does. Look him up. Is he attached or she attached to a hospital? Is there some background work that the person has done, whether written papers, written books, been published in scientific journals? What is the qualification that is mentioned on his or her, either if they are lucky enough to have a website, or even the referral. Okay. And always remember one thing: if usually a referral has been made, it is often made by a person who's happy with what they have got, right? So if today I refer
Yes.
you to someone, it's usually that I have had some experience with that someone and I trust that someone. So I think, Venkatesh, you would also be able to be hopefully helped by that someone. So a lot of our practice is referral practice, no? Because I all I need is one satisfied client, and that one satisfied client can be my best marketing tool, right? Because once I am happy with you, I will
Yes.
keep coming back to you and spread the word that, you know what, this person knows what she does, she's good at what she does. I think you should give her a shot. And of course, not necessary, therefore, that if they come work once, they're going to like you. But well, it's worth a risk of spending 5,000, 6,000, whatever it is, okay, of going and getting that one session and then making up your mind. So I would never advise anyone to block out 10 sessions, pay up in advance, and have these packages. I don't do that at all. I leave it to my clients. There is no package system. You have to feel the value of your time, your money, and of course, the kind of help that you believe you are getting for you to keep visiting me.
Got it. Last couple of questions. This one is pretty much an offshoot again of what you were saying, which is, you did say that we need to do a lot of research when one
Yeah.
is looking for therapy. In many cases, though, people are not up for that kind of research. So it kind of leads me to my question, which is, a lot of family members, sometimes the friends, believe that a person should seek therapy or mental health help, but that person themselves, the person himself or herself or themselves, they don't want to. So does it work ever when a family member or a friend, a concerned friend, says, I have made an appointment for you, you should go, and then decide whether you should continue or not? Can you kind of force, I mean, I don't want to use the word force,
Yeah,
but
I
can you
understand.
force mental health help?
No, you can't, but I'll tell you that at least the way I work, I know the referred clients are the most difficult clients, very honestly. But what happens is that now, once a person has been compelled to come because, well, he or she can't say no to the spouse or to the parent or to the brother or to the sister, and the therapist has been informed. So I've always been told that, hey, you know what, he or she's a resistant client. They are just coming because they have to. Then it is the skill of me, my art. So therapy is a science, but at the end of the day, it's based on a science. But at the end of the day, it's an art. If I know that someone has resistantly come, it is my skill as a therapist to be able to do something in that one session, so that he or she wants to come back. So yes, I have to sell myself in terms of I have to be able to show them some hope, some light, something which will make them say, hey, you know what? It was not such a bad idea to go see her. So yes, resistant clients are usually clients who come not of their own volition, who are often, unfortunately, as you rightly said, forced, compelled. There's a kind of compulsion, but then it's the responsibility of the therapist to be able to have them give you something which says, wow, it's not such a bad idea to maybe come back again.
Right. Varkha, I've gone through therapy, and I looked for therapy to help me with a difficult situation, and it took me a couple of tries before I settled on a therapist. So, from my own experience, and I'm from the experience of a few others I know who go to therapy, it seems like there seems to be you try once and then you go to somebody else and then you go to somebody else. Is it kind of normal to go to two, three, or four, or however
Absolutely.
many it takes?
Absolutely. You have to fit the person, the personality, the what is the therapist in terms of what is the module or the educational tool that this therapist is going to use with you. As I said, mine is tough. So not everyone likes what I say. And I'm okay with that. And then, of course, the reverse also happens. I find that there are some clients who I find extremely hard to work with because there's just no chemistry, there's no connect. And then I myself say that, you know what, I think we're not getting too far. Maybe you should get a second opinion or get a third opinion. So you have to be very open minded. So there's an entire book, Therapists Therapize Themselves, that first we have to be absolutely at ease that we are not gods. We are not some supermen or women. We have our own inabilities, and we have to have the courage to accept it and to allow the person. Because at the end of the day, if we are in the helping profession, I hope the goal is to help. The goal is not to control, the goal is not to retain. And I have done it every now and then where I feel that, we're not getting far, that I say maybe you need to try another therapist. And people have been quite amused and quite happy to hear that, and then they go, and then they have very good things to say about you. In fact, it just happened last week, 2 weeks ago. I had someone who was very upset with the kind of work I had done with her and her husband about a year and a half ago. And I said, okay, she's never going to come back, because she's been so upset with the way the therapy has unfolded, particularly in couples therapy. They expect you to be a judge and take sides and point fingers at the other person, right?
Yes.
1.5, 2 years later, I get a call, and I actually told my husband, I said, you know what? I'm going to ask this girl that you were so unhappy with me. So I asked her, I said, you were so unhappy with me. I'm glad, happy to have you back. I have no problem. If someone's unhappy with me, you have every right to be. Okay. So she laughed and she said, yeah, but I think I've gone around and I think I want to come back, because I think the way you dealt with whatever you dealt with was the only thing that really made a difference to me. So you
Mhm.
are going to have disgruntled people. That's a part of life. We can't please all the people. So I would like to put it out there. And what is this definition of this mental health and mental illness and everything? I get so annoyed now, actually, because there's so much of overdose of the term mental illness and mental health. In my very simple and my thought out way, I believe a large part of mental wellness comes when we don't care about what other people think of us. A lot of us are so, and especially today in the last 5 years with social media, we are all in the spotlight of trying to be something. And honestly, sorry for the word, but if I don't give a shit of what you think of me, I'm mentally healthy, because then I can make calls, I can make choices which are mine, which are not being propagated or suggested by society. In fact, I do believe that a lot of confidence is nothing but not worrying too much about what people think of us. And I think a mentally healthy person is that.
And that's a great note to kind of end this conversation. But I just don't want to leave it at that. Is there anything you feel that we've not discussed, especially keeping in mind the needs of somebody perhaps who wants to seek help and isn't sure where to go? Any last words?
So I think over time, and I think the last year and a half has really not been a very nice one for most of us. Emotional fragility has been like exposed. In fact, I think this pandemic, if I look around and I see the fear and the panic that has consumed people, it has really exposed the fragility of the human mind. And why are we so fragile? I think we are so fragile because none of us have been taught about living life in probability, with probability. We're all seeking security. We are all seeking certainty in very uncertain world. So I think it is important in our education, in our rearing up our children, and I do believe a lot of resilience and emotional muscle and psychological fortitude and stamina starts at the crib. That we are pandering to our children, we are not allowing them to suffer any consequences of their behavior. We are actually bringing up uh, kids with labels like brittle, handle with care. And then when real life happens, they're just not able to cope. So if you ask me, I think one of the suggestions I have is that let's start living in realism. Let's allow ourselves to face consequences of behavior. Let's allow our children to fail when they're not able to deliver what is expected of them in schools, in classes, in colleges. They need to face the consequences. Let's not always keep repeating to them ad nauseum and make them delusionally believe that they're the best thing that happened in life. They are not. They need to earn their place. However horrible it sounds, at the end of the day, Emotional stamina is nothing but realism. And it is about realizing that if you want something, you have to earn it, you have to work for it. I'm not saying you have to deserve it, they're two different things. But you have to work for whatever it is that you want. But in the generation of instantaneous, immediate satisfaction, I think we've forgotten how to endure, how to be able to, manage things when they don't go our way. All the time, the children are being actually pampered and agreed to go on with whatever it is that they are asked for. That's one. Two, I think let's have the courage to be ordinary. I think
Okay.
we've been so all carried away with extraordinaries. Everybody wants to win a Nobel. Everybody wants to be on Netflix. Everybody wants a million followers on social media, etc. And I think in this need to be extraordinary, we are so conscious about how we are being perceived, how we are being judged. We are so worried about what other people think of us. So I think the courage to be ordinary would relieve us,
Yes.
and give us what is life at the end of the day. I believe life is only two: to be healthy and to be happy. And we are constantly tense and taut because we're worried what you're thinking of me, how many likes I've got, how many people are following me. Is that really life? I think we have to review the entire last 5 years or maybe the decade of this entire digital media platform that has come, which has actually driven some of us round the bend.
So, Varkha, thank you so much. You answered every question that I put to you, and I think a lot of people are richer for this, having listened to this conversation. And I'm assuming that anyone who wants to look for more help is all they have to do is look.
Absolutely. I do believe that here we invest so much time in researching what car to buy or what phone to buy. Why would we not put that extra effort when it actually sometimes comes to the wellness of our lives?
Yeah, that's a great thought to leave this conversation, on. And thank you so much, Varkha, for joining us.